Welcome to Regent rptv. Today we bring you coverage from the rally outside 330 University Ave, where advocates gathered as an Ontario court heard a charter challenge against the province's plan to shut down 10 supervised consumption sites by April 1st, 2025. This includes the harm reduction site at Regent Park Community Health Centre, a vital service that has saved lives and prevented overdoses. The charter challenge, led by the neighborhood group and 2 individuals who used the sites, argue that Ontario's law violates the Charter of Rights and Freedoms, specifically the right to life, liberty, and security of the person. Safe consumption sites have proven effective in reversing thousands of overdoses, reducing the spread of infectious diseases, and offering a safer environment for people who use drugs. Despite this, the Ontario government is moving towards an abstinence-based model by converting 9 of these sites into homelessness and addiction recovery treatment heart hubs. Public health experts warn that closing these sites during a toxic drug crisis will increase overdoses and deaths, with marginalized communities like the downtown east neighborhoods being most affected. As we face the potential closure of the Regent Park site, it's important to highlight the voices of those advocating for the preservation of these services and to reflect on what's at stake for the community.
Safe consumption sites have provided thousands of referrals to life-saving supports. Harm reduction is an evidence-based practice rooted in the autonomy over our bodies and our love for one another. The closures of safe consumption sites, a decision by the provincial Conservative government, is archaic and is rooted in morality politics. The argument that safe consumption sites make a neighborhood unsafe is an outright lie. How does a service that saves lives make a neighborhood unsafe? For whose safety are we speaking? People who use drugs deserve to live. When people go to the OPS, they are quite literally entrusting me with making sure that they stay alive. They are entrusting us with their own life. Many of the people that I see are from my own urban Indigenous community. I see firsthand how my own people are disproportionately impacted by the toxic drug supply.
Our hearts break all the time as we bury people, and we collectively have to go and identify bodies and find people that we know dead in their own homes, something I wouldn't wish on any of them. Supervised consumption sites have an access point for people. This isn't about treatment or not treatment. This is about care and love and community and a place to be safe from a toxic drug crisis that's killing people because of the war on drug users and the people who use them. It is going to only get worse all the time. Now we have nitazine, now we have xylazine in the mix of our drugs because there is always going to be an underground economy of drug use and drug sellers. And that is why we fight for legislation and regulation and decriminalization, because we know these laws kill people. What the government is doing right now is so shameful. My heart goes out for SES workers and people using the site as you sit here wondering about your own jobs or knowing full well that leaving that organization, that point of access where you work, is closing. I'm sorry about that. But I must remind you, just like what was said before, that none of this came about because government said it was okay. Naloxone was smuggled over the border by people who are no longer here. Dan Big was a drug user. He created the first naloxone kit in 1996. He was my friend, and he overdosed and died, and he helped us bring thousands of vials of naloxone into this country before it was even legal. Supervised consumption sites operate illegally all over the country. Just because you haven't heard of them doesn't mean they don't exist. This is a colonial institution that does not care about our lives. It does not care whether people live or die, but we do. So no matter what happens in court the next 2 days, we better fucking win. But no matter what happens in court the next 2 days, what we have learned from each other is that we do have the spirit and the fight to do it ourselves. We were told we could not open a supervised consumption site. We were told it had to be very clinical. We were told how it had to look and who had to work there and how it was going to be. And we didn't listen to that. We saw people dying. At that time, 1 in 8 people, one person was dying every 8 hours in Ontario. Now it's 1 person every 2. In the spirit of that, I say to all of us, when we say we keep each other safe, we need to get ready for what that means next. And we need to not be afraid, because the struggle is a lifetime of struggle. Since I was young, my friends OD'd and died. My friends from childhood are all dead. All of them. They were Indigenous and they were Black, and they should still be alive. Their parents never got to see them grow past the age of 20, 21, 22. When we talk about children, that's what we're talking about. We're talking about people who changed their lives and are now raising their kids because they're still alive, and trying to fight for people to live is a very worthy venture. And that's why we're here in court. The Toronto Overdose Prevention Society is in court right now with the Toronto Harm Reduction Alliance, with the Waterloo Region Drug Action Network, and with the Canadian Drug Policy Coalition as interveners in this case, because we don't want more people to die, and people should not have to die from a preventable death. This is just one fight. We have so many more. And I want to thank the applicants, the drug users who have put themselves out there to be applicants in this case. The amount of vitriol, the amount of hate that gets slung at people who use drugs, who openly say, that's who I am and I need these services to survive, is so next level. But I want you to know that we appreciate you so much for what you're doing in this fight. We appreciate you for being honest and open, and we appreciate you for being applicants in this unjust court challenge. We shouldn't have to be here. I'm going to want to say one more thing for people who don't know. When we got here today, the courtroom was not big enough for us. The courtroom was not big enough for the lawyers. That is so unjust. It is an assault on our public institution that we couldn't actually be in the court together. That is an assault on us. Interveners, applicants should have been able to be in the main courtroom. I've been to court a lot in my life. A lot. And for my own charges even. And this is the smallest courtroom I had ever been in. And then there's these 2 overflow rooms, and for the first part of it, we couldn't hear anything. It went on for 20 minutes. We also were supposed to get a web link so everybody could watch, because this is important to the public. This is about people beyond Toronto. There are sites in Ontario where there's no complaints about what they're doing. There are no affidavits from people at those sites saying, I don't want the site in Thunder Bay. There is nothing like that in the government's evidence. Nothing. They deserve to be able to watch what's happening here too. That is an affront on everybody. And we know attacks on our democratic process, all of that is happening at a very accelerated rate right now. But we hope that the process that happens today is in favor for us. We have amazing experts. Our experts are so solid because they actually do the science and the research. They are actually people with experience. They are people from here. They had 1 person from Ontario. 1 person from Ontario. It's so shameful. It's so shameful. So I just want to thank everyone for being here. I want to thank everybody for being part of this, everybody who has been fighting and organizing. That's all we can do. We just have to keep showing up. We have to keep fighting. The struggle is endless. When you say, you shouldn't have to be here. No, the struggle is a lifetime. It is a long haul. If you're in solidarity with communities, this is a lifetime struggle. So be prepared to be in it for the long haul, because it doesn't stop here. It ends with ending the war on drugs.
Don't forget to like, share, subscribe to our YouTube channel, and visit us on all our social media platforms. Please visit our website for more information.